Boris Johnson was supposed to set out today England's plan for living with COVID. Instead, he delivered no plan and just encouraged us all to ignore COVID.
Because of the efforts we've made as a country over the past 2 years, we can now deal with it in a very different way, moving from government restrictions to personal responsibility. First, we will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test. And so we will also end self-isolation support payments, although COVID provisions for statutory sick pay can still be claimed for a further month. We will end routine contact tracing and no longer ask fully vaccinated close contacts and those under 18 to test daily for 7 days. And we will remove the legal requirement for close contacts who are not fully vaccinated to self-isolate. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate to others. From today, we're removing the guidance for staff and students in most education and childcare settings to undertake twice-weekly asymptomatic testing. And from the 1st of April, when winter is over and the virus will spread less easily, we will end free symptomatic and asymptomatic testing for the general public. We will continue to provide free symptomatic tests to the oldest age groups and those most vulnerable to COVID. And in line with the practice in many other countries, we're working with retailers to ensure that everyone who wants to can buy a test.
So a legal requirement to self-isolate will be replaced with guidance, but only until April, at which point you should go to work when sick. If you do want to do the responsible thing anyway and self-isolate, there'll be no financial support, but you probably won't know anyway, as free tests are on their way out. As we expected, there were no announcements on ventilation or any other investment that could keep us all safe from COVID and other respiratory viruses. This is how Keir Starmer responded.
Huge efforts have been made over the last 2 years, and we would not be where we are today without the heroism of our NHS and key workers, those who pioneered and rolled out the vaccines, and the sacrifices that people made every day to follow the rules and protect our public health. We must honour the collective sacrifices of the British people and do everything possible to prevent a return to the loss and lockdowns we've seen over the last 2 years. The Prime Minister promised to present a plan for living with COVID. But all we've got today is yet more chaos and disarray. Not enough to prepare us for the new variants which may yet develop. An approach which seems to think that living with COVID means simply ignoring it. This morning, he couldn't even persuade his own health secretary to agree the plan. So what confidence can the public have that this is the right approach? Mr. Speaker, we have to take the public with us, and that requires clarity about why decisions are being made. So will the Prime Minister publish the scientific evidence behind his decision to remove the legal requirement to self-isolate, including the impact on the clinically extremely vulnerable, for whom lockdown has never ended? Having come this far, I know the British people will continue to act responsibly, and they will do the right thing, testing and then isolating if positive. What I can't understand is why the Prime Minister is taking away the tools that will help them to do that. Free tests can't continue forever, but if you're 2-1 up with 10 minutes to go, you don't sub off one of your best defenders. The Prime Minister is also removing self-isolation support payments that allow many people to isolate and weakening sick pay. These are decisions which will hit the lowest paid and the most insecure workers the hardest, including care workers who got us through the toughest parts of the pandemic. It's all very well advising workers to self-isolate, but that won't work unless all workers have the security of knowing that they can afford to do so.
Moments later, Johnson described those fairly reasonable concerns like this.
He asks about the clinically extremely vulnerable, and that's, of course, an entirely reasonable question. But what we are going to do is make sure that they continue to be protected with priority access to therapeutics and, of course, to vaccines as well. He asks about testing, Mr. Speaker, which is absolutely satirical, because week after week, month after month, I've listened to the Labour Party, Mr. Speaker, complaining about NHS testing, denouncing the cost. Did you not hear them, Mr. Speaker? Denouncing the cost of NHS test and trace, and now they want to continue with it when, Mr. Speaker, we do not need to go on with it in the way that we are currently doing. So he asks about our ability to do tests, or our domestic ability to manufacture tests. It's as though he doesn't know, Mr. Speaker, that we have in this country now one of the biggest manufacturers of lateral flow tests in Europe. Mr. Speaker, this is a leader of the opposition who, as I say, has shown an absolutely ferocious grip of the wrong end of the stick.
It's quite a good line, but I don't know if he should have been joking about such a serious topic. Keir Starmer was asking about the clinically vulnerable, who are at this point in time, understandably, incredibly worried, because Boris Johnson is now saying, let's all just completely ignore COVID-19. If you're sick, forget about it, essentially. If you can go to work, go to work. Don't even try and find out if you've got COVID-19.
From the latest available polling, which is from December, what Boris Johnson has announced in terms of scrapping free tests is not popular with the public at all. It's a very, very marginal position, but it's not a marginal position on his own backbenchers. And I think we can see this move as a fairly cynical attempt to shore up his support, because he's, of course, quite vulnerable as the Partygate scandal rumbles on. He's looking at what's going into Sir Graham Brady's inbox, and he's looking to beef up his support amongst those lockdown skeptic and, quite frankly, COVID denialist portions of his own party support. That's what this is about, plain and simple. It's got nothing to do with how you effectively shift into a phase of pandemic management, which you could plausibly describe as living with COVID. Because every measure that's been announced, the weakening of self-isolation payments, returning to statutory sick pay only, which we know is set at an absolutely risible level in this country, and the scrapping of free testing, what this effectively does is throw income poor people onto the mercy of the pandemic. We saw through this pandemic that you were at greater risk of exposure, a greater risk of serious disease, and greater risk of death if you were in a so-called elementary profession, which meant you had high level of exposures to other people and also precarious working conditions and low wages. That's exactly the group of workers who are most endangered by this measure, because they have a weaker position when it comes to taking time off work, and they also have more limited incomes, which means that they're less likely to be able to afford testing, which isn't free. This also, once again, throws disabled people, even more so than they have been, on the mercy of the pandemic as well, because having priority testing for them isn't enough. It's like saying, okay, if you're disabled, you get to wear seatbelts, or you get to abide by the speed limit, but nobody else does. If I'm not testing and I'm walking around and I'm completely unaware whether or not I've got COVID, I am more likely to infect somebody who is clinically vulnerable. So from a healthcare perspective, this is completely reckless. And from a political perspective, it is entirely cynical. And I'm afraid Keir Starmer's performance, some of his performances in the Commons have been quite good. This was a really lackluster performance. The concession of saying, we can't have free testing forever. Well, why not? People don't pay for STI tests. I can't think of other tests for infectious illnesses which are charged at the point of use. So why can't you keep free testing? absolutely disgraceful from the Prime Minister, and I think, unfortunately, weak from the Leader of the Opposition.
I mean, watching the address in Parliament today, I frankly thought it was completely disgraceful. It was just Boris Johnson saying, any support we gave you is over. We can't do that anymore. Just get used to it. Go to work when you're sick. If you're clinically vulnerable, apologies. Right? Essentially, that's what it sounded like to me. I do think, though, that my initial reaction to they're going to end the legal compulsion to isolate, I was like, well, that, maybe we have got to the point of the pandemic where that can be voluntary, but that would need to be combined with an instruction to bosses that if your worker wants to stay at home because they've got COVID-19, let them. And it was the precise opposite actually in Parliament today, because Boris Johnson was saying, essentially, unless you're really sick, go into work. That was the message that the public got from that. The same with testing, because I know you're saying, I don't think the test should cost money, but at the same time, I don't think there are any other testing programs whereby you're just encouraged to take them all the time if you don't have any, particular risk factors, for example. So an STI test, obviously it's free, but you go to the STI clinic and you get it, or you go on the website and say, I've been in contact with someone with an STI, blah, 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 blah. So I think this idea that, everyone's encouraged to take 2 lateral flows a week or whatever, I can see how we might want to move beyond that and have a more targeted testing system. But again, that's not really what Boris Johnson was describing. What Boris Johnson was describing was to say, look, don't bother testing. Even if you're symptomatic, don't get a test. Why is anyone, when they've got a sore throat, going to go to the chemist and spend money on a lateral flow test when even if they find out they've got COVID-19, they're still expected to go to work and they don't get any support if they want to self-isolate?
But it's also, don't bother testing if you think that you've been exposed. So to use the STI example, you are encouraged to have an STI test if you think that you might be exposed, not because you necessarily know that someone's got an STI, but because you've had unprotected sex. You are encouraged to have STI tests regularly in terms of, changing sexual partners. These are all things that you are encouraged to do. I don't think that it is, I think it's a false economy to scale back on testing in this way and to impose a charge. And I think that what this is about isn't thinking about how you move to that living with COVID situation where you have the right calibration of interventions, the right calibration of monitoring. It's pure COVID denial.
Also, the problem here is that for me, the pandemic could have been an opportunity, right? Because I'm of the position that we need to move beyond a situation where we think of COVID-19 as this completely exceptional thing and we sort of separate it from all other public health issues. And we say this is the disease that we have to completely get rid of and we have to completely transform our lives to suppress it. I think we've moved past the point where that's necessary. But I think what should have happened after this pandemic is to say, okay, we are going to have to live with this virus, but let's make the changes that will make us safer from COVID-19 and make us safer from all other respiratory diseases as well. So that's things like good sick pay. That's things like ventilation in all public buildings. I've seen people make great analogies to how sort of like the cholera epidemics encourage states to invest in clean water. And like, that wasn't easy. When people say, oh, ventilation, that'd be so difficult. I think ventilating buildings is actually easier than piping cities with clean water. It's just that our government can't be bothered because they don't want to stump up the cash. They don't want to intervene in the economy in the way that would be required. And that would not limit any of our freedoms in any way at all, but they just haven't bothered to do it. And why I find it disappointing because, I'm not that worried about COVID. I've had it before. It didn't affect me that much. I'm young. I don't have any clinical, well, I'm not that young, but I'm youngish. I don't have any clinical vulnerabilities. But even I'd prefer not to get COVID 2 or 3 times a year if I can. So I'd be in favor of better ventilation in public buildings. But the main thing is I think Boris Johnson stood up there today and say, look, we are going to have to change our approach to this virus. Vaccination has changed things. Maybe we will target tests more. Maybe we'll move away from sort of the legal compulsions. We are going to focus less on COVID now, but I'm going to bring you with me. And especially if you're clinically vulnerable, I'm going to bring you with me. And part of this trade-off is while we go back to sort of, the same situation, even though I can't guarantee you're not going to get COVID-19, what I can say is you will be healthier than you were before this pandemic, because what we're going to do is we'll invest all this money into ventilation. So not only are you safer from COVID, you're safer from other diseases. We're going to introduce sick pay. We're going to, I don't even like the word radical, because this isn't radical. This is incredibly moderate. We are going to restructure society so it is more inclusive of people with clinical vulnerabilities as we go into the long term. And it was the precise opposite. It was basically, if you're still concerned about COVID, you're an idiot. Forget about it. And what that ignores is that there are some people who are very rationally not over COVID because they have specific vulnerabilities. If they're immunosuppressed, there are 500,000 people in Britain whose immune systems won't necessarily respond very well to vaccines, potentially because they're on drugs, because they've had transplants, or because they've got other conditions. And they were told today, screw you, get over it. Yeah, you're going to be at more risk from dying now than you were three years ago, but we've got to move on. I didn't think Keir Starmer's response was that bad. I didn't think it was particularly pithy, but you're more critical of everyone who was in Parliament today, you Ash.
Well, I think so. I also wasn't in love with the 10 minutes to go, sub off your best defender line. It was a bit, no pun, laboured. But I do think that it was a weak defence of the principle of free universal testing. I think that is a principle that we have in every other section of our health service. So it seems bizarre to me that you have this unique situation where testing for COVID is the only one that you have to pay for. Because I hear what you're saying about moving towards a scenario where COVID isn't this entirely unique disease. I still think in some ways it is, because of the question mark hanging over long COVID, thinking about its long-term effects, how it is potentially different from other kinds of post-viral syndromes, still thinking about how long COVID relates to Omicron, though there is some indication that you're less likely to get long COVID if you are vaccinated, which is yet another reason to be fully vaccinated if you don't have a medical exemption. But there are reasons why caution is still wise. I'm not one of those people who thinks that until you achieve zero COVID, you have the tightest, most restrictive measures possible. That's not what I think. I believe in mitigation, but I also believe in monitoring. And I think that what the testing policy is about is abdicating that responsibility for monitoring in order to please the headbangers on his backbenchers. It doesn't really have anything to do with all of us having happier, healthier, and freer lives. Because, like you said, if that's what Boris Johnson was after, it would be about investing in ventilation. It would be about facilitating people to take time off sick when they really need it. It would be about bolstering sick pay provision for people. This is just about having your hands over your eyes, your fingers plugged into your ears and going, la, 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 I'm not listening.
In their defense, they are doing some monitoring. So there were rumors that the whole ONS sort of infection survey was going to get cancelled. They are continuing that. It's ambiguous as to, how much they're going to scale it back. But obviously there are problems with that, which is that, there's a 2-week delay or whatever. The bigger problem for me, though, with that is they haven't said what they're monitoring it for. So again, I think the deal you could have made with people who are rationally more concerned about COVID than someone like me is to say, look, we are going to move away from a situation whereby people always have to wear masks in supermarkets or XYZ other restriction that we've got used to living with. But if the rates of COVID go above this, we'll bring it back. So you can be confident that when we're in a situation where people aren't wearing masks, your risk of catching it is not zero. It's not gone, but it is, it's smaller than it would be. And when the ONS Infection Survey discovers that 1 in 10 people have COVID, obviously I'm just plucking the number out of thin air now, then that's when we say, okay, now given that we're in COVID season, if that's what we're going to start calling it, maybe or not just maybe, you're encouraged to wear your mask on the tube, you're encouraged to wear your mask in the supermarket. And I think that would be the sign of a society which was a little bit more compassionate than the one that we are moving into now, which is actually kind of less compassionate than before the pandemic, which is really, really depressing, to think we've gone through this huge collective experience as a nation, really difficult. We all had to pull together and we've ended it kind of crueler than we entered it. Like that's depressing, isn't it?
Well, yeah, it's wholly depressing because we didn't have a supportive healthcare infrastructure economy for disabled people before the pandemic. And now this framing of the ending of not just all restrictions, but also free testing and the extra income support for COVID self-isolation, it is presenting any sort of concern for the quality of life for disabled people as being antithetical to freedom. So that's how it's being, pushed by Boris Johnson's ministers. They're saying, we will be the freest society. Our liberties are back. I don't feel much freer having to fork out £5 for a lateral flow test, knowing that if I don't, reach my hand into my pocket and do that I'll be endangering the clinically vulnerable people who are in my life. I don't feel particularly liberated by that. I don't know about you.